for joining the live. Please like and subscribe if you're not subscribed. I'm guessing you're here already, so you might be subscribed. Thank you so much for joining. Please give me a thumbs up. That would be great. And if you can share the live as well. I know it's quite late from where I'm filming from in the UK, but I wanted to come live anyway. Today I'm going to be talking about how to hand express breast milk, whether it's just to make you feel comfortable or whether you want to express colostrum before baby's born, and to or just to hand express breast milk to help for somebody else to feed the baby with your breast milk. So I just want to go through some things first. When you're going to express your hand, make sure that you are very relaxed, first of all, that you are not feeling stressed, you're not under any strain, you're not feeling anxious about anything, because when it comes to expressing your milk, it's very, very important that you've got your mindset right and you are either thinking of baby, if baby is born, then maybe baby is near you so you can see the baby, or you can hear the baby, you can smell the baby, or you can touch the baby. This is going to help for your letdown reflex to work in well for your milk to come as much as possible. So if you are going to hand express, make sure that you are comfortable, you are happy, and you are mentally prepared to do just that. Okay. So to hand express, you need to make sure that the breast is prepared first of all. So make sure that you are either using any sort of, you've just maybe come out of the shower first of all, you're really relaxed and your milk is ready to be expressed. Okay, if you haven't just gone out the shower, that's okay. What you can do to help is that you can maybe use a warm compress, which so maybe like a face towel, run under warm water to help for milk to be easily extracted. So if you have a flannel, you can put a flannel all around the breast, and you're going to also do some hand massaging, meaning that you're going to be doing, you make your hand like this, and you are going to massage all around the breast, okay, to make it nice and supple and soft. And whilst you're doing this, you are thinking of baby, okay? You are either looking at baby, you are having some form of attention on your baby if your baby is already born. If your baby is not born yet and you're trying to collect colostrum, then of course bear in mind that colostrum is very, very thick. It's very small in amount, and therefore it's not going to come out lots and lots and lots. It's also very thick compared to your full milk when it comes in from about day 5. So be mindful that it may take some time, okay? Don't worry, don't stress if you don't get much at all, if you haven't had your baby yet. Continue to hand express, continue to try to express, giving stimulation to the breast milk ducts. And that's what is also going to be very important for after the baby is born. So if you don't get anything, it doesn't mean that you don't have milk. So rest assured your body will produce milk once your placenta is delivered, okay? So if your baby is not born and you're going to hand express, you're not going to do it for very long, okay? So maybe starting off, you may do for maybe 5 minutes at a time or in one day. You're also going to then increase every other day or the next day that you're going to hand express again. Your colostrum is very thick. It's not going to come out that easily. So express it really, really gently to begin with. 5 minutes on the first time or even 3 minutes. And then the next time you try again, increase in the times really slowly and make sure that you're comfortable with how long you're doing it for. Um, if you are going to be expressing after your baby is born and you're going to express to give to baby, so let's say you've gone past your first 5 days and your milk has come in, okay, and you want to hand express rather than using the machine to express, then this is how you're going to do hand expressing of your breast milk. First of all, you have to make sure, as I said before, the breast is warmed up when you've done some massages around the breast. And what you do is that you are going to make use your thumb and your index finger like this, just around the breast. So you're not going to pinch your nipple at all, okay? You don't need to touch the nipple, you don't need to do any nipple stimulation or anything like that. You're going to go to the back of the areola, maybe 1 to 2 centimeters below behind it, and you're going to put a firm press on the breast, You're not going to press too hard in order for you to bruise or to injure or to feel pain, okay? You're just going to press and squeeze, just holding it in place like this for a few seconds. Whilst the milk is coming, you can stay in that same position. If no milk is coming out yet after you've held and pressed for about 10 seconds, you can simply let go gently and move your hand around to another position. You're going to press again and just hold in place. Okay, you're not going to do anything where you are pressing onto your skin and or milking forwards. This is going to leave you very sore, and you are also then not staying in the same place in order to give enough time for the milk to go through the milk ducts and to extract from the nipples. So make sure that you press and you're going to hold for a few seconds, okay, maybe 10 seconds, see what's happening. And then you're also going to move around the breast and squeeze in a different position. Hold again for 10 seconds, let go, and you're going to be moving around and pressing and waiting, okay? You can also go back to massaging again all around the breast like this, okay? And then you're going to go back to pressing and waiting and we're holding for milk to come out. Move along, press and wait and hold for milk to come out, okay, for a few seconds. And you can alternate between your right breast and your left breast. It may take between 20 to 30 minutes for you to be able to extract milk from both breasts, for you to feel comfortable or for you to have enough amount for you to give to your baby. Let's say if your baby is about 6 days old, 7 days old or so. So remember, you are going to be going back to the areola. You're going to use your thumb and your index finger, and you're going to hold at the back of the areola, maybe 1 to 2 centimeters away. You're going to press and hold for 10 seconds. Or if you feel like you're in one position and you're still getting milk, stay in that same position until the milk stops coming, or if it slows down a lot, okay? Then that means you've exhausted this area. So you move your hand off and you're going to go to another position and you're going to express again from that side and wait until you feel like you've exhausted that area again. And then you're going to go back and position again, exhaust this area, and you can go back again to massage it, moving the milk towards the milk ducts at the front of the breast, and then you're going to do it again. You're going to alternate between left and right breast and wait until you feel like you've extracted as much as you can, or you feel like you're not getting any more. Then you can stop. When it comes to storing the breast milk, there are many different ways of doing it and there's different combinations. So let's say you've expressed in the middle of the night and you're not going to give it to baby. You can leave it in room temperature for up to 4 to 6 hours, okay, before you need to give it to baby. If you're not going to give it to baby after about 4 hours, we will recommend that you put it into the fridge. Make sure that the fridge is nice and cold and it's at the right temperatures. Put it right at the back of all your items in the fridge so that it stays as fresh as possible. Because with the opening and closing of your drawers, of your fridge doors, really often you can get this milk to, if it's at the front, to be not as good as it can be within a shorter days that you've kept it in the fridge. So always put it right at the back of your refrigerator. If you want to express and put it in a fridge, make sure that you are expressing into a sterile container, like a bottle that you've already sterilized, or you're going to put it into a milk collection bags that you can put in a fridge or you can store in your freezer. When it comes to freezing your breast milk, you can freeze your breast milk up to 6 months, or some people may keep it even longer. Okay, but we would say 6 months is a good time to keep your breast milk for. Make sure that you label your breast milk when you're going to store it in a freezer, because when you start to use it, you want to try and use the ones you've expressed before or the oldest ones before you use your new ones. So if it's not labeled or it's not dated, you're not going to know the difference between which ones you expressed first and which ones you've expressed last. So always label the breast milk, okay, before you store it away in the freezer. Make sure that when you are going to warm up your breast milk, so let's say you've expressed, you've put it in a fridge, not the freezer, you've put it in a fridge, and now it's been maybe a couple of hours, and now you want to feed baby with that breast milk. What you do is to make sure that you take the breast milk out of the fridge. You're going to leave it in warm water. Make sure that the water is not too hot because you don't want to overheat breast milk. When breast milk is overheated and you have to wait for it to cool down, the taste of it changes a lot, okay? It almost goes like bitter rather than when it's sweet like sugar normally. So if you overheat it, the baby most likely will not like it, and they will take a really long time to drink it. And this is going to take a lot of effort for them to do this. And when babies use a lot of effort and energy and resources to eat, instead of them gaining as much weight as possible, they will tend to slow down in their weight gain, or even sometimes they may lose weight if they're using too much energy to feed and before they get what they need from the feed. So please make sure that you don't overwarm the milk. You would take it out the fridge, you put it into warm water, only for a few minutes, just so you can take the chill out of the milk, not to make it go too hot or to make it overheated. Okay, you're just taking the chill so it doesn't feel cold when you put it onto your own skin. So once you've done that, you can give it to baby. Remember, once you've warmed up your milk, you only have up to 2 hours to give it to your baby. Unlike when you are giving formula feeds, you only have 1 hour to give to the baby. So once you've warmed it, ready to give to your child, please make sure that you are looking at the time and you try to get baby to feed from the milk that you've warmed up to 2 hours from the time you've warmed it and they've started eating. So then let it exceed this time. If baby doesn't drink it all within that 2 hours, make sure that you are discarding it and not giving it back to baby, and you're not going to definitely refrigerate it again. Okay, I hope that makes sense. So if you've warmed up the milk, you have 2 hours to give it to baby for baby to finish. If baby doesn't finish it, you're going to discard this milk and then get the next feed with a new batch of milk that you've stored. All right, hope that makes sense for you. If you are going to do only expressing and feeding your baby, so you're not actually going to put your baby to the breast, but you plan to breastfeed either solely or mixed with some form of formula supplement, but you don't actually want to attach baby to the breast, you want to just express your milk and then feed it to the baby, we would definitely recommend using maybe a machine to express your milk just to make it much quicker for you. And of course, if you get a double pump, you can pump at the same time, which will give you a lot more of a it will cut down your time that you're using your hand to do expressing if you are only going to be expressing for baby to be feeding from the expressed milk rather than baby latching on and you expressing some milk sometimes for somebody else to feed the baby with. Okay, so if you're going to do only expressing to feed baby, please do get yourself a machine, a really good brand that you know you've been recommended to, or that you feel somebody's told you that is good, or the hospital's told that is good. Then of course you can use that. I will link um a link on Amazon for a nice machine that mums and other mums have definitely recommended on Amazon, so you can have a look and check it out and see if you think it will help you. But do make sure that you are using a nice machine that will give you as much milk collection in the time that you are going to express. The recommendation for expressing your milk with the machine is make sure that you're only expressing at least 15 minutes, no more than 20 minutes each side of the breast. You're going to wait at least, 2 to 3 hours, or you're going to try and mimic as often as your baby feeds and for as long as baby feeds. But the advice is to make sure that you're not expressing too frequently. So let's say between 2.5 to 3 hours is what you're going to wait in between expressing your milk, because this is what we think baby would do if baby was feeding just on the breast without any supplements. And also, if baby was feeding from you, they will be regulating the amount of milk you make depending on how much they go on to feed. Okay, so you're trying to mimic what baby would do if your baby was latching on and feeding from you directly. So give yourself time for your milk to for your breast as well to be settled and not to have too much pain, and then to make sure that you are mimicking what your baby is doing. When you are getting a breast pump, the best advice I can give you is to make sure that you get one with the correct size nozzle for collecting. Okay, you want to make sure that the pump you're getting, the nozzle that you're using to pump, is not too small and also is not too big. If you get an incorrect one, this may cause you a lot of pain and discomfort when you're pumping. It can then also then lead on to you know, really, really heavier breast milk production. You may also then lead to mastitis if it's not the right one and you're not extracting your milk. It can then also then affect your milk supply and make you feel like you don't have a lot of milk and you're not getting enough because you're just not extracting as much as you could do, or you're too discomforted, so you're not doing as often as you should do as well. And all of this can affect your milk supply and how much you can pump. When you're using the machine, as I said in the beginning, you have to make sure that you are thinking of baby. You are either looking at baby, you are smelling baby, you are sensing baby, you are doing something with baby so that it helps for your letdown reflex to work. Because if you're expressing, because you're not expressing or it's not your baby sucking from you directly, the emotional connection is different with the machine or when you are hand expressing, okay? So you need to be thinking of baby to help your body to sense the fact that you're going to be giving this milk to your baby. It's going to be going to the baby. It's all about the baby. And therefore, your body's more relaxed and it will help the let down reflex to work and for you to be able to collect as much milk as possible. So please make sure that when you are pumping, you are thinking of baby, you are relaxed. You're not thinking of what's for dinner, what the shopping is like, who's going to walk the dog, who's picking up your child from school. All of that is going to make a big difference to the amount that you collect. It's also very important that you are aware that breast milk supply and how much you extract can be affected by your environment. Okay, if you're in an environment where you are not able to focus, you're not able to relax, you're not able to think clearly, you are looking around at things, you are worried somebody's going to drop something, somebody's going to do something, and you're constantly looking around and not really focusing in, and you're not relaxed, this will affect the amount of milk that will come out. Okay, so your environment is really, really important. So even if you're getting your mindset right or you're looking at baby, but you've got a really chaotic environment that's stressing you out or that's putting pressure on you, this is going to affect your milk production and how much milk you're able to express. So make sure that you are, you are in an environment that you're comfortable with. Also, it's important that you have the right people around you. So don't be trying to pump and you're worried that somebody's going to see you naked. Somebody's going to see that you've got your breast out or there's a bit of you showing, and you're constantly worried and looking around, making sure that they can't see that you're pumping or anything like that. This is going to affect how much milk you're going to make, because if you're thinking about it, your mind is going to be wandering, okay? So you're not going to be focused in on the thing that you are doing, even if you're trying really hard. If something is distracting you, or if someone is distracting you or making you feel a certain way, is going to definitely affect how much milk you're going to be able to extract, okay? So please make sure that the environment is right, you're around the right people, nothing is stressing you out, you're not worried, you're not anxious, you are not thinking of any other thing apart from the fact that you are making this milk to give to your precious baby. And that's the focus. Okay. So this is what you need to be thinking and doing to help you to extract as much milk as you can when you're doing it either by hand or you're using machine to do it. So I hope this video is making sense to you. If this video is helpful to you, please like the video, share the video to other people, and then of course subscribe to the channel if you're not already subscribed, so you'll be able to notice and see when I come live or when I put up new videos. Please ring the notification bells when I come live. You'll be able to be seen, you'll be able to see it and join the live as well and ask your questions in real time. Hope this live was really useful to you. Thank you so much for joining. If you're watching it after the live, then thank you as well for watching. And I hope to see you in the next live, which is coming out this coming Friday. If possible, if there is an issue, then maybe I'll do it before or I'll do it after. I know this weekend or this Friday is going to be my work Play's Christmas party. So I'm hoping that I'll do the live earlier than usual time. If not, I'll have a live up next on the following day, which will be the Saturday. Thank you so much. Hope you're looking forward to having your baby. If you've already had your baby, congratulations, and we look forward to seeing you again in the next live. Take care and have a lovely Christmas. Bye for now. Bye.